My name is David Ginsburg. I'm a urologist at Keck USC School of Medicine, and I'm actually a urologist that sees a lot of patients with neurogenic lower urinary tract dysfunction, including a lot of patients with multiple sclerosis. So we're going to talk today about how multiple sclerosis can impact your bladder function. So we know that a great majority of patients with MS are going to have some type of bladder dysfunction. In fact, up to 50 to 80%. But there's really two main types of bladder dysfunction we'll see. One is a bladder dysfunction you have trouble storing the urine. The other is we may have problems emptying your bladder. And we're going to differentiate between the two because I really want you to understand how that can impact issues. Before we go there, let's talk about how normal bladder function works. All right? So what normally happens? Kidneys make urine, the bladder slowly fills, and as you fill, you get a little bit of an urge to urinate. And as that urge increases, you think, okay, I'm going to go to the bathroom sometime soon. And when it's proper for you, you'll go to the bathroom when you want to, where you want to, and your bladder is essentially going to empty to completion or pretty much close to completion. So let's break down that normal process and where we can see how MS can impact that in a way that none of us like. So, first part, bladder fills. That's what normally happens. Now, what can happen with MS is two different things. You can have impaired sensation, which means your bladder can get really full and you don't hardly feel anything. Or you can get a strong urge to void much sooner than what would be considered quote-unquote normal. All right? Now, as the bladder gets full, I said you'll get an urge to urinate, and urge is normal. What is abnormal is urgency, which is that feeling of, oh my gosh, I got to get to the bathroom right now. And if I don't get to the bathroom right now, you may feel like you're going to have an accident. So you may have urgency. Then when it's time to go to the restroom, you go when you want to. Right, like I said, in an appropriate location, whenever you want to go, and it starts when you want it to. What may happen with multiple sclerosis is that you may get this urgency that is so strong, you may leak on the way to the bathroom. Okay? And lastly, you void. You void when you want to, and you're going to empty your bladder to completion. And things that we can see with multiple sclerosis are two different potential issues. One is you may not be able to go at all, or the other is you really can't generate the stream when you want, or when you do go, you don't empty your bladder completely. And it may not be that you can't go at all, but you are going a little bit such that you leave so much behind that you're full again and half an hour later, whatever it may be. So we can break that down with an illustration. So if you look at the illustration on I guess you're looking at the monitor on your left side, this is again that quote-unquote normal bladder behavior where the bladder is going to normally fill, you'll have an urge to void, and you empty to completion. And what happens, what we can see with multiple sclerosis is, use this term overactive bladder. We also can use a term bladder spasm, that bladder is contracting without your permission. We can also use the term diffuse overactivity, which is a urodynamic term. We'll talk about urodynamics later. But essentially, that bladder contraction that would normally occur when you want to void is now occurring without your permission, leading to that urgency and sometimes leading to leakage. So let's think about some of the signs and symptoms you may see with bladder dysfunction from multiple sclerosis. All right, there are a variety. So if you look at those first four, those are what we call storage symptoms. That's what we associate with overactive bladder. Urinary frequency, voiding too often, urgency, gotta go right now. Nocturia, which is our fancy medical term for saying you're getting up at night, and incontinence, often associated with urgency. What are the signs associated with emptying issues? So it's hesitancy. Can't get the stream started initially. Maybe it's a poor force of stream, poor flow, or incomplete bladder emptying, which may be a symptom, like you feel like you don't empty your bladder completely, or a sign when you come to the doctor's office and we'll check and say, wow, you got a lot of urine left behind. Another sign may be recurrent bladder infections. That could be a sign that something is amiss. And I want you all to appreciate that there can be overlap. You might have some of those first 4 symptoms that are stored symptoms. You might have some of the symptoms below that are emptying symptoms. They're not mutually exclusive, but they are all signs that maybe something isn't working optimally, and you may benefit from evaluation. So what is that evaluation? You come to see your caregiver, we'll take a history. We want to understand what your symptoms are, and most importantly, what's bothering you, what it is you want us to make better. We're going to do an exam. Take a feel in your belly, make sure it feels like you're emptying your bladder okay. A genitourinary exam. In a female patient, it may be a pelvic exam. In a male patient, feeling the prostate. Maybe a brief neurologic exam. We're not neurologists, but often we'll do a little bit of that to get an idea of what's going on with the MS and how it may impact your bladder symptoms. We'll probably get a post-void residual. You see on this illustration on the picture, just using a little ultrasound over the bladder to let us know how much urine is left behind in your bladder, and get a urinalysis to check for maybe an infection or other issues. So some other common studies that you may do when you go see your providers to evaluate your bladder function. One would be a bladder diary. Very simple. We often just ask you to keep track for a 24-hour period of time, maybe 1, 2, 3 different days. And during those days, you write down the time you void. You measure the bladder volume. If you have an incontinence episode, we'll ask you to write down the time, why you had it. Maybe it was because you had an urge, you couldn't get there in time, you had a cough, you had a sneeze, you had a laugh, whatever may happen. And then we may do urodynamics. This is a test that we will do for patients that often don't respond to standard medical therapy. This is a great test and gives us a lot of information. We put a very small pressure reading catheter in the bladder. We're going to fill your bladder through that catheter. We're going to measure the bladder pressures through that catheter. And the whole goal is to try to recreate what happens at home to allow us to figure what the next step is. Some patients think, oh my gosh, you're putting a catheter and it's going to be terrible. It's an easy test, not a problem. It may sound terrible. It really, most patients say not a big deal, and we get a lot of information from that. So to summarize, a significant number of patients, up to 80% with multiple sclerosis, are going to have some kind of bladder dysfunction. General term is neurogenic bladder. It can be problems storing, which again is frequency, urgency, maybe not getting to the bathroom in time. It can be related to problems with bladder emptying, poor flow, not emptying your bladder completely. And a lot of times some of these problems will overlap, and that's okay. We can treat both of those issues. We need to evaluate these issues carefully to figure out where we're going to go with treatment, to try to figure out what bothers you the most to make these symptoms better, and that allows us to optimize treatment. And we're going to talk about treatment in the next lecture. So I look forward to hopefully seeing you in the next video, and hope everyone has a great day. Thank you very much.